Good day, this is Jeremy Dalon, a nursing student from the University of Mindanao. Today, I'm going to do a procedure which is starting IV infusion. By definition, it is giving a fluid substances directly into a vein. It can be intermittent or continuous. Continuous administration is called an IV drip. The word intravenous simply means within a vein but is most commonly used to refer. The purposes of this are to maintain or replace body stores of water, electrolytes, vitamins, proteins, fats, and calories in the clients who cannot maintain an adequate intake in mouth. Second, it is to restore acid-base balance. Third, restore volume of blood components. Fourth, administer safe and effective infusion of medications by using the appropriate vascular access. Next is to monitor central venous pressure, provide nutrient while resting the gastrointestinal tract, and to establish a lifeline for rapidly needed medications. The equipment that we need for this procedure are the IV fluid, the IV tubing, the tourniquet, the cotton balls with and without alcohol, the surgical tape, the scissor, and the IV cannula. The nursing considerations for this are asepsis or sterile technique is observed. Check or read the doctor's order and identify the amount and type of solution and the flow rate of infusion. Observe the patient level of consciousness. Always check the vital signs. Select the client's appropriate site for IV insertion. Involve play and distraction techniques, relaxation, and other coping skills appropriate to the age of the child who needs intravenous therapy. Determine if the client is sensitive to additive in the solution, ointment, or surgical tapes. If necessary, weigh the client and examine the skin turgor. Then, if the site is hairy, shave the area of intended site of entry. First is to check the doctor's order and make an IV label. Next is wash hands. This prevents the spread of microorganisms. Then gather all the equipment and prepare the IV solution and tubing. Having all equipment available saves time. Then check for the IV fluid, especially in its expiration date. So this IV fluid will expire on May 2026. It was manufactured on May 2021. Then also check for the IV tubing, especially also in its expiration and instruction. Also for the IV cannula, this cannula will expire on March 2025 and it is manufactured on May 2020. Tubing, uncap the spike and insert it into the entry site on the bag or bottles as the manufacturer directs. If an additive is ordered, incorporate it before inserting the spike into the entry site. This punctures the seal in the IV bag or bottle. Suspend the IV solution on a hook in the preparation area and press the drip chamber and allow it to fill at least halfway. Suction effect causes fluid to move into the drip chamber and also prevents air from moving down the tubing. Notify the physician or nurse who will insert the IV. When he or she arrives, bring preparation to the bedside. This facilitates accomplishment of the task. Then, identify the client and explain the procedure. Explanation allays the client's anxiety. Client in a supine or low Fowler's position. The supine position permits either arm to be used and allows for good body alignment. The low Fowler's position is usually the most comfortable for client. Suspend the bag or bottle of solution on the IV stand. The fluid height should be 18 to 24 inches above level of the vein. This height is sufficient to overcome the venous pressure. Hand the tourniquet to the doctor or the nurse, followed by a CB with alcohol and the needle or the Vasocan. Observe while the doctor or nurse is inserting. Anticipating the needs of the doctor is one good characteristic of a nurse. The tubing to the needle. Start the flow of solution promptly by releasing the clamp on the tubing. Examine the site for signs of infiltration. Blood clot readily if IV flow is not maintained. If the needle accidentally slips out of the vein, solution will accumulate and infiltrate into the surrounding tissue. Support the needle with a small piece of gauze or tissue paper under the hub, if necessary, to keep the needle in place. The pressure of the wall of the vein does not offer resistance to the movement of the needle. The weight of the tubing is sufficient to pull the needle out of the vein if it is not well anchored. Put the tubing near the site of the entry and anchor it with plaster to prevent pulling of the needle. The smooth structure of the vein does not offer resistance to the movement of the needle. The weight of the tubing is sufficient to pull the needle out of the vein if it is not well anchored. Lower the arm to an arm board for support if necessary. An arm board protects against change in the position of the vein and acts as a reminder to the client to minimize arm movements. Adjust the rate of flow according to the doctor's order. The physician prescribes the rate of flow. Label and tape to the IVF bag or bottle. After care of the equipment and wash your hands. This deters the spread of microorganisms. Document the procedure and the client's response. Chart the time, site, device use, solution and rate of flow, and the physician or the nurse who inserted the needle. This provides accurate documentation and ensures continuity of care. Then monitor periodically at least every 30 minutes to check flow rate and observe for infiltration and other untoward symptoms. This documents the client's response to the infusion. If infusion is not flowing well, lower the bottle or the bag to check if the line is still patent. Never flush or pinch IV tubings of infusion. Next is regulating intravenous flow rate. The purposes of this are to comply with the prescribed rate ordered by the physician, to maintain an equal and constant rate of fluid administration throughout the duration of the infusion, to assist in reassessing the progress of the fluid infusion, and to prevent circulatory overload and insufficient correction of hypovolemia. Check 2000. Next is discontinuing intravenous infusion. The indications for this are the client's oral fluid intake and hydration status are satisfactory so that no further IV solutions are ordered. Then, there is a problem with the infusion that cannot be fixed. Lastly is the medications administered by IV route are no longer required. So, Mrs. Jones, now we are going to discontinue the intravenous infusion because your hydration status is now in its satisfactory rate. Lastly, record the amount of fluid infused on the I&O record sheet and on the chart if necessary. Include the type of solution used, time and reason for discontinuing the infusion, and the client's response. This ensures accurate documentation of client's response. This has been Jeremy Dallon, done for intravenous infusion.